So we've been called to a 40-year-old male fallen out of a tree. As we arrive on the scene, we're checking for dangers. We see a saw that he's been using up in the tree to cut branches. There's a ladder. We're just going to make sure that the ladder is stable and that the saw is not going to injure us. Other dangers that we may find in the area are people, just making sure that people are standing back and giving us room, and the environment. If it's a cold day, we may need to consider warmth, etc. for the casualty. Approaching the casualty, we're now going to check for response. Hi mate, can you hear me?
I can hear you.
You can hear me? Okay, just lie as still as you can. I see you've got a great big bleeding hole in your arm there, so we're going to deal with that first.
Stop bleeding.
Okay, so bring your arm up for me. I'm just going to put some pressure on that initially. Okay, so he has a venous bleed, it's flowing, it's not arterial, it's not spurting. So we're going to get some dressing on here, put some pressure on. We've got a dressing strip that Jess here is putting some moisture onto. Put that on and we'll hold that in place. And then we're going to have a bandage over the top of that to put some pressure on it. Right. So as we're doing this, so what exactly happened to you, mate?
I was up the ladder with the saw and I fell off.
You fell off the tree. How far have you fallen?
About the fourth frame.
Okay, so I want you to lie as still as you can, keep your head as still. We're going to check you over shortly for any other injuries. But seeing as you've had a decent fall, I just want you to lie as still as possible in case we've got any spinal injury. Alright, so we're just going to relax that on your chest. Looks like the blood's already coming through that. Can we put another dressing on top of that to help soak that up and get the pressure on? Okay, do you have any pain anywhere else in your body?
Just my leg.
Your leg? Whereabouts on your leg?
Ankle.
Your ankle hurts? Which ankle?
Right ankle.
Right ankle. And can you tell me what the pain feels like?
On the ankle?
Yep.
7.
7? 7 out of 10?
Yeah.
Okay, does it go anywhere else or just in your ankle?
Just in the ankle.
Have you had any previous injuries there, or is this from today?
I broke it a few years ago.
Broke it a few years ago? So does it hurt because of what happened before, or is it new pain today?
It's a new pain today.
Okay, so we'll look at that in a moment. So, let me just have a look at that. No, blood's still coming through that, so I'm now going to apply a tourniquet because it appears to be uncontrolled bleeding. So, we're going to put a tourniquet on your arm because the bandage is not controlling the bleeding at the moment. I'm just going to put it on your upper arm here. There will be pain as we tighten this up, but we need to control that bleeding so you don't lose a whole lot of blood and go into shock, alright? So I wrap that round, put the Velcro on. So I put the cat tourniquet around his upper arm on a single bone limb, 10 centimetres proximal to the wound. I'm then going to tighten up the windlass until the pulse disappears and then recheck the dressing to see, underneath the dressing, to see if the bleeding has stopped. We're not going to actually put that tight on this casualty, we're just going to leave it there for demonstration. Alright, has the pulse stopped?
Yes.
Pulse has stopped, alright, we'll just check under the dressing to see if it's bleeding. No, we appear to have the bleeding under control. Alright, can you just rest that one across your chest there? Alright, so can you now do a set of vitals on him? So my partner here, Jess, is going to do a set of vitals. She's going to be checking blood pressure. Do you normally have high blood pressure, low blood pressure?
Low blood pressure.
Low blood pressure, do you know what your normal figures are?
105/70.
105/70, okay, thank you. So Jess is going to take a blood pressure and we're looking for changes in the blood pressure. If that's his normal blood pressure, we'll hope it's somewhere in the same region. High blood pressure could be an issue, low blood pressure could be an issue. We're going to monitor any changes in it. If it starts dropping, then that could be an indication that he's going into shock, has lost a significant amount of blood and going into shock. Other vitals that Jess will be taking, she'll be taking a pulse to get a heart rate, seeing the rate, how strong it is, irregularities. She'll also be doing a respiratory rate, checking to see how fast he's breathing, how well he is breathing, if he's using accessory muscles. She will also auscultate the lungs, so listening with the stethoscope to see if there's any noises in the lungs, crackles, wheezes, etc. to indicate any lung problems. Also, we'll be doing a blood glucose level, a little prick in the finger to get some blood and test his blood glucose level. We won't actually do that because we don't need to poke him today. Glasgow coma scale. So the Glasgow Coma Scale is made up of eyes, 4, verbal, 5, and movement 6. So he has his eyes open to as we approach, so he's got a 4 there. He is coherent and talking well to us, so he's a 5 for verbal, and he's able to follow all instructions, so he's a 6 for motor, so he has a GCS of 15. Okay, so we'll also do a temperature. We've got a thermometer we'll put in his ear to check his temperature and see how that's going. We can also check capillary refill on the extremities. We'll be doing that as part of our secondary assessment. If he's got a good pulse, then that's an indication that he has good perfusion through his body. Okay, while she is doing that, I'm going to be asking the casualty some questions to get some history. So we found the wound on your arm here. We've put a dressing on that. We seem to have the bleeding under control. I asked you about any pain before, and you said your right ankle. Okay. Do you have any pain anywhere else?
No.
Okay. Are you allergic to any medications?
Aspirin.
Aspirin? You're allergic to aspirin? Okay, we'll make a note of that. Past medical history. Do you have any medical conditions that we should know about?
No.
No? No medical conditions to note. Do you take any medications for anything?
No.
Any drugs or herbal remedies that you've been taking?
No.
No? Okay. When did you last eat?
This morning.
This morning?
Had some toast.
Toast? How long ago would that have been?
3 hours.
3 hours ago? Okay. Any coffee or anything since then?
3 cups.
3 cups of coffee? Okay. And when you fell, what was happening?
I was using the saw to cut off a branch on the tree.
Yep. Did you feel faint, dizzy?
I suffer from vertigo and I think I just lost my balance.
Do you remember falling?
Yeah, I do.
Do you remember hitting the ground?
Yep.
You do? Did you hear any noises when you hit the ground, snaps, pops?
No.
No? Okay. Just try to remember to lie as still as possible while we're doing this, yeah? All good?
Vitals? Yeah.
Yep, done the vitals. Okay, can you start on a secondary? So we're going to do a secondary assessment on you. For this, Jess is going to run her hands over your body, checking to see if there are any deformities, bleeding anywhere else. If you feel any pain anytime, tell her. Is that okay?
Yep.
Okay, so Jess is going to start a secondary assessment. She's going to start at the head. She's going to check the head for any soft spots, bleeding, etc. She's going to also check the face, facial bones, eyes. She's then going to carry on down. We're going to go down his neck and see if there's any tenderness in his neck, and then onto the shoulders, the collarbone, etc. Checking the ribs, down each limb, putting pressure on to see if there's any crepitus movement, swelling anywhere, any bleeding. Does that hurt?
That hurts.
Can you give me a number out of 10 for how much that hurts?
4.
4?
About a 4.
Okay, so just lie as still as possible. That may indicate there's a spinal damage. We're going to be putting a collar on you shortly to support your neck, all right? Can you tell me if it goes anywhere else? Does it shoot anywhere?
No.
When did it start? When did that pain start?
It's just been a dull ache there since I fell off the ladder.
So it started when you fell off the ladder. It's just been a dull ache in the back of your neck.
Yeah.
Okay. Onset for when he fell. Provocation. Does anything make it feel better or worse?
No.
No? Okay. And it doesn't radiate?
No. If I keep my head straight, it seems to be better.
Does anything make it better? Holding your head straight?
Yeah.
Yep, okay, so just keep your head really straight. OPQR, severity we've done, 4 out of 10. And this only started when you fell off the ladder?
Yeah.
Correct? Okay.
Also pop the shoes on.
Okay, so Jess is just going to take your shoes off so she can check your limbs as well, your feet. Does that hurt?
That hurts, yeah.
Okay. Again, can you tell me, out of 10, how much that hurts?
That's good. That's a good one. It's about 7.
That's a good 7?
Yeah.
Okay, does it go anywhere up and down your legs? Yeah, take your shoes off.
Is this
Just from my ankle up through the...
Shoots up your leg a bit?
Yeah.
Okay. And that started when?
When I fell off the ladder.
When you fell off the ladder? Did you land on that foot?
I think I must have.
You think you must have? Okay. Does anything make it better or worse?
No.
No, it's just constant?
Yeah.
Okay. So we're going to take his shoes and socks off. So We're going to remove his shoes and socks so we can do some limb baselines, compare the two. We're looking for pain, unnatural movement, swelling, deformity, irregularities, crepitus, any shortening of the limb, and fractures may also cause a person to go into shock. We're going to be monitoring for him for signs of shock. So if he starts getting very pale, very faint, feeling sick, if we get an increased heart rate, increased respiration rate, or if the blood pressure starts to drop, that's a late sign that he's going into significant shock.
There seems to be some deformity.
There seems to be some deformity. Yep, so we think that your ankle might be broken. We're going to be putting a splint on that before we transport. Yeah? Okay. Right, do you want to do a neurological assessment? So check his sensation and movement. Jess is just going to get you to squeeze her hands to see if you can do that appropriately. And check for sensation. Can you feel that?
Okay, yeah.
You can feel that? Okay. She's going to do the same down your legs and onto your feet. Now we know that your right ankle hurts, so she's not going to do much with that, yeah? But checking the other foot. Can you push against her hand? Can you pull up against her hand? Yep. That's good. Sensation. Can you feel both legs?
Yeah.
Can you feel both feet?
Yeah.
Okay. So we're going to put a collar on you to help you keep your head very still, all right? So indications here for the collar is that he's got midline tenderness. He has no neurological deficit on either limb. Also, the mechanism of injury, falling out of off the ladder, could cause a significant risk to the spinal. So we're going to be putting on a collar. We may decide not to put on a collar if the person is fully cooperative and is able to hold their head still. Also, if there are any issues around the doctor's ABCs, then we won't be putting it on because we need to manage those. If there's an airway issue, we need to be managing that, so we won't put a collar on for that. If we are not putting on a collar for any reason, then we will be instead putting on the lanyard that says they are not clinically cleared for spinal, and that will go through to the hospital as that for them to check in the hospital. Alright, so I'm just going to roll this before I put it on. Jess is going to hold your head nice and still while we put on this collar. Yeah? So just remember, whatever we're doing, I want you to lie as still as possible and not move your head around. Yeah, I'm just going to slide this under your back of your neck, bring the collar up under your chin and onto your chest. Right, I'm just going to reset that a little bit, get it in the middle. We want the center of the collar lined up with the center of his face and down to the center of his chest. Alright, and the Velcro. Alright, can you tell me if that's comfortable?
That is.
That is comfortable? Has that helped with your pain at all?
That's cute. Yeah, it seems to. Yeah.
Seems to? Okay. So normally we would also keep the manual stabilisation on, keep the head restrained as well as possible as well. However, we need to go on to splinting, and for that we're actually going to take the collar off for comfort of our casualty here while we get on with the splinting and stuff. Okay, I'm just going to remove that. Okay. So, we need to put a splint on your ankle to be able to get you onto a stretcher and transport you, okay? Now, I know you've got a lot of pain at the moment, so one of the things we're going to do is give you some medication to help control the pain. All right? That'd be good? Okay, so we're going to use methoxyflurane, the green whistle. Have you ever heard of the green whistle?
No.
No? Okay. So it is an inhaled medication, so we're going to get you to hold on to it and you're going to breathe it. I just need to ask some questions before we get onto it. So do you have a history or family history of malignant hypothermia?
No.
Do you have any renal problems, kidney problems?
No.
No? Have you had methoxyflurane in the last week? GCS is good, and do you, I already asked if you had any drug allergies, so you said you've never had methoxy before? So we won't know if there's an allergy unless it occurs. We will be prepared for that. Yep. Okay, so with the 7 out of 10 pain in his ankle, I'd like to give him some methoxyflurane to reduce the pain before we put a splint on. So I've asked him the questions. I'm pretty sure you heard that he has no malignant hypothermia, He has not taken any in the last 7 days. He has a good GCS, so he's cooperative and everything. He does not have any renal impairment that we know of and no allergies that we know of. So I'd just like you to check the methoxy, make sure that we have the right dose.
Have methoxy 3 mils and it is within the expiry date. Excellent.
So we're going to give him methoxyfluorine, 3 mils, today, 8th of the 6th, and the time is 10:46, and we'll record all that.
Yep.
Any questions about that?
No, I'm happy with that.
You're happy with that? Okay. So Doug, we're now going to give you a bit. So the methoxyfluorine, we would get it out of the box. There is a carbon filter which goes on the top, so when they breathe it out, it filters out so we don't breathe it all. There is a 3 ml bottle here. The 3 ml bottle we would open up, pour into the end, swirl it around to mix it up in there, and then he would be able to use it. For an adult, we can give them 2 vials of 3 mils. For under 12, it would only be 1. Okay, so here's your green whistle. I'll just get you to put your hand through the lanyard there. Yeah? You're going to hold on to that. You're going to suck on it. And if you want extra strong, you're going to put your finger over the little hole. Okay, so put that end in your mouth. Take a couple of deep breaths, blowing back through the whistle. Don't blow out through your nose or anything. So breathe in through the whistle, blow out through the whistle. Do that another couple of times. Take a couple of deep breaths, 3 or 4. Remember to blow out through the whistle. Okay. So, can you tell me what that pain in your foot is like now?
That's about 3.
About a 3 out of 10. You may feel a little bit woozy, dizzy with the methoxy.
I feel a wee bit lightheaded.
You feel a little bit lightheaded. That's a normal response to this medication. If you feel really uncomfortable with that, we can stop it. It's up to you when you use it.
Yeah, that's good.
It's good. So I would advise when we start moving your leg that you take another couple of deep breaths just before we do that, and I'll mention it when we get there, yeah? Take another couple of deep breaths when we're about to put it on, because we're going to have some movement, yeah? Okay, so Jess has prepared a cardboard splint. She has cut and taped, so we've got a foot-shaped segment here. We're going to line it with a towel to pad it out with little lumps to fill the voids behind the ankle and up in the knee. We're just going to use some triangular bandages to strap it on. How many have you got? 2? Have you got a third one?
No, we got a bandage.
You got a bandage? Okay. Right, so what I'll get you to do is if you can lift his leg while I slide it in. I'll come around to where you are, if you come around this side. And you did some limb baselines.
Yes.
So we've got, we're looking for colour, warmth, sensation, capillary refill with a good in both legs.
Yes.
So there's no vascular impairment. So he has good colour, sensation and capillary refill, so we don't have any issues with blood supply into the limb. Right, so I'll get you to hold his foot and his lower leg. So Doug, we're about to move your leg, so it's a good time to take a couple of puffs on that methoxy. Take 3 or 4 and then we'll move your leg. Right, lifting the leg up, I'm going to slide the splint in. If we can just gently put his foot down into the splint. Alright, okay. So then Jess is going to support it and hold it while I put on one triangular bandage down here, pulling it reasonably tight but not so tight that it causes any pain. Tell me if this hurts as I'm putting it on, Doug.
It's not bad.
It's not bad. How's that pain out of 10 at the moment?
I just took some more puffs on this thing.
So what level have you got at the moment, do you think?
About a 3.
About a 3, that's good, that's excellent. Keep it up. Alright, so I'm going to put 2 on the lower leg to hold it rigid there, and then I'm going to use the crepe bandage to wrap it around his foot. Okay, so just keep puffing away on that methoxy if there's any pain, Doug, and tell me how you're feeling. Feeling alright there, Doug?
That's good. That feels good.
That feels good.
It's a lot better than what it was.
Okay, thank you, Jess. You can relax that. Okay, so having Put the splint on, then we will recheck the limb baseline. So I'm going to do a capillary refill. That looks good. Can you feel my hand on your toes?
Yes, I do.
You can. And it's still the same warmth as the other leg. So, and it's a good colour. So colour, warmth, cap refill, and sensation. He's got all those good. So I've got a good splint. Awesome. So now we'll be ready to put you onto a stretcher and transport you.